What's going on, everyone? Welcome to today's pandemic update for Tuesday, May 23rd, 2023. Hopefully everyone is staying safe. If you had to take a COVID test in the last 24 hours, hopefully you have tested negative. It is a very busy news day today. We'll start off with India, then we'll move on and talk about how maybe COVID's starting to become more severe again in some countries. Yes, there's concerns that it could be more severe again. We'll get to all this in today's update. Active cases in India have dropped to 7,104. India has logged 405 new coronavirus infections, and just 4 deaths have been added in the last 24 hours. Moving on to this. This is not good news at all. China braces for new COVID wave, with up to 65 million weekly cases possible. Repeating, 65 million new COVID cases are possible. And this is expected per week by the end of June. So that's something we're going to be watching. And this would be from the XBB variants, one of the new ones, which is highly transmissible. So this is not good news at all. And then we come to this. Heart of the matter. Sudden cardiac arrest among teens on the rise. We're just reading a headline here. That's not good. It's something we have been suspecting has been happening for some time. I know I personally have been reading a lot of comments from people about different things in relation to, oh, so-and-so's at a track and field event, and they're seeing people with sudden heart or chest pains, and here you go. Cardiac arrests are on the rise. Moving on to our next thing here. This is not good either. Surge of COVID across Canada as hospitals drop mask mandates. COVID is on the increase in Canada. The XBB.1.16 variant is starting to drive a wave, and unfortunately, hospitalizations are going up. Cases are starting to go up. It's a sign of what's to come here in the United States, and as you'll see in a little bit, New York State, or New York City, here in the United States, is starting to rise as well. Moving on to this. Monkeypox virus can survive on surfaces up to 30 days, says a new study. If you want to read the full study, I did tweet this out earlier today. That's rather concerning because you got to understand. So it could survive on the surface for 30 days. Let's just say, after 20 days, someone touches the surface that still has monkeypox. Well, keep in mind, after that, you still have the, 28 day incubation period for monkeypox? Do the math. I mean, that's a really long period of time. You could potentially be looking 20 to 50 days from time a surface gets contaminated to time someone could get infected. So that's a long window of time where anything could happen. And plus, during that period of time, that person who maybe doesn't show symptoms or test positive for all that time could be potentially exposing other people. So nothing good comes out of monkeypox. All right, Jimmy Buffett is heading home from the hospital after being hospitalized. We don't know what he was hospitalized for, but we do know that he was hospitalized. More celebrity news. Jeff Bridges reveals tumor has shrunk, so he did have a cancer tumor, in case you haven't been following, but he says it's been nothing compared to COVID. And if you read this whole thing here, it says here, in 2021, the now 73-year-old contracted COVID-19 and has admitted he came very close to dying due to a weakened immune system from the chemotherapy. So he's basically saying, it says here, for me, Bridges told the outlet, cancer was nothing compared to COVID. So he's actually admitting that COVID was really bad. And you know what? We don't see that too often. We don't see many actors, celebrities admit how bad their COVID case really is. So I really commend him for doing that. I really give him a lot of praise. It takes a lot to come out and say that. All right, now on to this. Next pandemic is bound to come knocking, so better prepare, warns the WHO. And yeah, they're right. And I've been mentioning this for about a week now. I'm really starting to get concerned in regards to H5N1 bird flu. I think that poses a real threat to us. We'll just have to wait and see how that one plays out. Could it be tomorrow? Could it be several years from now? Something is going to definitely come down the line, and it could potentially be worse than COVID. And with how politicized COVID has become, I'm worried whatever the next thing is that could be worse, no one's going to take it seriously. Alrighty, this is a headline from the New York Post. I don't particularly care for the New York Post, but it's a headline. I just want to read the headline. 55% of New York City 12th graders chronically absent post-COVID. That's crazy. But, number one, they're saying post-COVID. COVID did not end. So already you're seeing why I hate the New York Post. And number two, when they get infected or get long COVID, yeah, they're going to be absent from school. So that's all we need to see about that. Alright, this is really serious. This has to do with Thailand. I believe this is the third day in a row we've mentioned something in regards to Thailand. Breaking. Thailand sees big jump in new COVID cases and fatalities. The weekly hospitalization cases reached 2,632 with an average of 376 cases per day. And we are hearing that there are cases of pneumonia. A lot of cases of pneumonia showing up with these COVID cases, which is not good. And that's something we saw at the beginning of the pandemic. So are these new XBB variants? Remember yesterday we reported there were something about 60 different XBB variants over there. So is COVID or these variants trying to go back to what the original strain could do, or a little bit of what Delta could do? Not good, but the fact that all these pneumonia cases are popping up and deaths are increasing and hospitalizations are increasing, there's indications that at least in Thailand, COVID's trying to go more severe. And like we said earlier, we're already seeing hospitalizations rise in Canada. I'm going to show you New York State hospitalizations in a little bit. They're starting to increase, so we'll see here. We don't fully know one thing, though. We don't know how well vaccinated or boosted Thailand is. I would like to do some research into that, and maybe I'll try and include that in tomorrow's pandemic update, what the percentages of vaccinated people there. But nonetheless, this is super concerning that we're seeing a nation like Thailand starting to see some more severe cases pop up. And we'll have to see how high their deaths get in the coming weeks. Moving on to our last news story of the day. This was breaking as of earlier. Public health officials are investigating an outbreak of an unidentified illness at a local primary school in Kenya. One pupil has died, while 19 others have been hospitalized. Symptoms include severe headaches and chest pains. Some also experience stomach aches. Now, we constantly, even before coronavirus, we have seen these mysterious illnesses pop up down there in Africa, Kenya, and all these, lower class countries, I guess you could call it. But the frequency of this happening has exploded, skyrocketed straight upward since the coronavirus pandemic because of the immunity issue. It is so easy for these viruses to breed and grow. Alrighty, taking a look at this. We did get the Walgreens update this week. If you didn't see that update, it was posted yesterday. It's down in the videos down below. I believe I have a playlist for that you can check out. And the national positivity from Walgreens, it's quoted at 24.1%, but that's not necessarily accurate because you have all these different places like Nebraska. Some states are not even reporting. It's just a disaster. So it's not very accurate information this week. Wastewater, nothing terribly concerning to show you here. We will be starting to concern ourselves about wastewater next week, post-Memorial Day weekend. New sites, 144. Sites that are in low transmission, 539. Sites that have low to near moderate transmission in wastewater, 424. Moderate, 128. Moderate to near high, 22. And just one is at high transmission, which is down in South Carolina. Taking a look at New Jersey. Hospitalizations in New Jersey, yes, they are starting to rise. They tried to do this a couple weeks ago. Now it's starting to rise again. Just back on the 19th, it was 156 people in the hospital. Now it's up to 179. 11 are on ventilators and 20 are in the ICU. Taking a look at my state of Pennsylvania. 784 ambulance EMS calls in Philadelphia County for May 22nd. That was yesterday. And let's do a live look-in, shall we? Let's see what's going on here in the suburbs of Philadelphia. Here's Montgomery County. We got respiratory emergency, some head injuries. Nothing too concerning at the moment. It's not our super-duper long list like we have seen in the past. Taking a look here at Chester County, we do have some respiratory calls, but the rest of them just look like the normal stuff. So, not a terribly concerning day. Thank goodness for that. Taking a look at New York State, you can see in the last 24 hours, 337 people tested positive. That does not include reinfections or at-home tests. And unfortunately, the positivity rate continues to rise. 3.6% positivity rate. 7-day average is now up to 2.6%. Remember, when you're missing all these at-home tests and whatever else is not included, the overall positivity as well is being impacted, and it's just continuing to rise. It's just not a good situation, and we'll have to see how high it gets. It dropped for so long, it was only a matter of time until this was to start happening. All right, taking a look at hospitalizations in New York State. Yes, they are higher again today. 585 people in the hospital, 66 people in the ICU. Let's take a look at New York City. And at New York City, yeah, hospitalizations are higher again today. 218 people in the hospital, 25 people in the ICU. And let's look at admissions for both levels. You can see the admissions are actually down ever so slightly today. And when we take a look at the statewide level in New York, again, admissions are down ever so slightly from last Tuesday at this time, but don't pay close attention to that. The overall trend, I think it's safe to say, is starting to rise because we saw the hospitalizations. They did go up again today. So we'll have to see what happens in the coming days. Taking a look here at some international data today. South Korea, cases are up 3%. Deaths are up 1%. And disclaimer here, some of this data may not be accurate because some countries are only updating weekly. And because of that, places like Australia, 38% down on cases, 54% down on deaths. It may not necessarily be accurate. We would expect to see Australia starting to rise now because they are entering winter. And New Zealand is doing just that. New Zealand is up 21% on cases, 22% on deaths. The Philippines are continuing to drop now. They were starting to level off. Now they're dropping. Down 2% on cases, up 1% though on deaths. 13 versus 0. I guess they only report their deaths every other week. I don't know what the deal is with that. Mexico, cases are up 147%, and deaths are up 263%. Vietnam, cases are down 23%, and deaths are down 25%. Italy, cases down 50%, deaths down 44%. Malaysia, cases down 25%, deaths are up 33%, 24 versus 18. India, cases still down 44%, as you saw in the India update. The caseload is dropping. Deaths are down by 36%. Then we come down here to Hong Kong. Cases are up 9%. Deaths are up 36%. Thailand, cases up 12%, though I believe that's likely probably an undercount. I don't think this is updated. And it still has a 191% increase in deaths. I don't think World Meters has updated this in some time. Hopefully, maybe they will update that today. Austria, cases down 22%, and deaths are down 30%. Alrighty, that does it for today's pandemic update. Like I said, in tomorrow's update, I'm going to try and get something going about Thailand's vaccination rates. I'm curious. Maybe you are as well, because the news coming out of Thailand is not good with these pneumonia cases that are popping up with COVID. So that's a bad combination. Something we saw in the early days of the pandemic. And hopefully we're not going back to that. If we end up going back to that, it opens up a whole new can of worms. The hospital situation gets bad again. We just have to see what happens. It's too soon to make any clear sense of direction of where we're headed. But we do know this much. There's going to be a summer surge. So I need you to do a few things. Number one, if you like this video, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below. And, of course, the most important thing is, until I see you again next time, stay safe. And thanks for watching, everyone. Have a great evening.